Hi, this is Sarah with A Step Ahead Tri-Cities, and during this video we're going to be talking about condoms, both internal and external condoms, or male and female, and we're going to also be talking about STIs, or sexually transmitted infections. So with condoms, there are different types of condoms. There are male or external condoms, and these are important at preventing STIs. In my other videos, we talked about birth control methods, and we talked about long-term acting birth control. Condoms can be used as birth control, but they're not as effective as the other methods that I talked about. If used as birth control, they're about 86% effective. But they should be used because they are so effective at preventing sexually transmitted infections. They're 98% effective at preventing sexually transmitted infections. That's why condoms are so important. But with condoms, you always want to make sure that you store them in a dry and temperature-stable place, like maybe your bathroom. If they're stored in the glove box of a car or maybe a wallet, then the latex or rubber can break down, and that can cause breakage to happen or maybe little holes to happen, and the condom won't be as effective. So that's an external or male condom. There's also female or internal condoms that are available too. These are a little different. They look different from a male condom, and they're sometimes used for vaginal or anal sex. They are 79% effective at pregnancy prevention. So they're not a great option for pregnancy prevention, but they are a good option for sexually transmitted infection prevention. That's why they're important. They're inserted into the vagina or anus, and they are actually not the same thing as a dental dam. They're different from that. So that's male condoms or external condoms, and then internal or female condoms. Again, not great at pregnancy prevention, but they are important for sexually transmitted infection prevention, which is what we're going to be talking about next. Sexually transmitted diseases, they now call them sexually transmitted infections, STIs. There are different types of STIs, that's how they're abbreviated. There's bacterial STIs, there's actually parasites, and there is also viral or virus STIs. The symptoms for the majority of STIs are broad but kind of the same in general. Some symptoms can be rashes, sores around the genital area, could be pelvic, abdominal, or even back pain. There could also be unusual discharge from the penis or vagina, but in a lot of cases, there's no symptoms at all. So a person might have an STI and not have any idea that they have it, and they could go around spreading that STI without having any idea. That's why it's so important that people go get tested for STIs once a year. Around our area, East Tennessee, I know the health departments will test for STIs, so it's important to get tested because a lot of times there could be no symptoms. There's different ways that they test for them. It could be a visual exam, it could be a urine test, or a swab. So there's different ways that they test for them. But again, it's so important to go get tested. With bacterial STIs, we talked about some of the symptoms that could occur, but some examples of bacterial STIs could be chlamydia, gonorrhea, or syphilis. These STIs, the sooner that they're diagnosed, the sooner that they can be treated. But if they are left undiagnosed and left untreated, then they could cause irreversible damage. That's why it's important to get them diagnosed as quickly as possible. There's also parasite STIs. An example of this could be like pubic lice. This is not the same thing as head lice. You wouldn't just go to Walmart and get lice shampoo and treat it that way. That's not how it works. You would actually have to go to your doctor's office or physician's office and get treated by a physician for the pubic lice. There's also viral or no-cure STIs as well. A common example of that would be HIV, or human immunodeficiency virus. This can be managed with medication. but also HIV can turn into AIDS. It's actually a dangerous and smart virus. It can live in the body and spread from person to person without a person knowing that they even have it. You can get HIV by coming in contact with bodily fluids from a person who has HIV. So if a person has HIV and you come in contact with bodily fluids such as semen, blood, breast milk, kissing, if they have an open sore on their mouth, you have an open sore on your mouth. It can also be transmitted through sex, vaginal, anal, and oral sex. You can also get HIV through dirty needles. So what that means, if a person has HIV and they use a needle, and then another person uses that same needle, then they can get HIV that way. You cannot get HIV just by sitting in the same room as a person who has HIV or shaking hands with a person who has HIV. You only get it through bodily fluid transmission. Ways to prevent HIV can be condom use, and then also a medication called PrEP, that's P-R-E-P, PrEP, that helps to prevent HIV. Herpes is another example of a virus, an STI virus as well. And then another example is HPV, or human papilloma virus. With human papilloma virus, there is actually about 100 different types of HPV. There's high-risk strains and there's low-risk strains. The high-risk strains could potentially lead to some types of cancer, such as head, neck, throat, or cervical cancer. So that could be potential high-risk types of HPV that can lead to that. That's why they do make an HPV vaccine. It's actually called the Gardasil shot. And this can actually prevent you from getting the high-risk strains of HPV. Typically, practitioners give the HPV shot before a child is sexually active. So the goal is to get them maybe when they're about 10 or 11 years old. It comes in typically 3 shots or 3 doses. And once they receive all of their rounds of the vaccine, then that helps prevent HPV strains and HPV-related cancers. So it's a great shot to get. It's a great option. That's a little bit about condoms, condom use, and sexually transmitted infections. If you would like more information about any of this, feel free to visit our website at www.estepaheadtricities.org. Thank you all for listening. Bye.